Actually, we've had a lot of interesting studies, but I promise this is going to be far interesting in the sense that we've always been talking about poor health services and also been talking about how healthcare workers have poor attitude. Some of the customers do complain, and even the WHO has given a framework that shifts patients from being just patients to actually clients or customers. So my study is on the lived experiences and also the response from these health workers. We are saying that your attitude towards work is poor. What do you have to say about it? So this is the first hand, and it's a qualitative study, focus group. We sat them down, and at the end of the study, I think you give me more hand clap. So okay, so we would start with what we know about customer care and what we know about patient satisfaction. What we know about customer care, we would move on to why the study is important. We would also talk about the methods and how we ensured that what the nurses said were not biased. We would finally look at the output from the study and some recommendations. So, universal health coverage looks at three things: access to health service, the quality of health service, and also financial risk protection. Customer care also looks at a similar thing. So customer care is the main determinant or one of the key determinants to achieving the universal health coverage. And it goes just beyond that. It also looks at the overall quality of health of the patient. Customer care influences service utilization, as already said, also hospital attendance rate. If the customers are happy with your services, they would obviously come. If they are not, they would stay at home and resort to other forms of treatment. Customer care problems are issues of public health importance because we are bringing out quality services in the facility. But what if the people we are bringing the service for are not patronizing their service? Then everything is cost 90. So this is very important. Customer care is directly linked with client satisfaction and also the overall well-being. And the Ghana Health Service in numerous occasions have said that the main challenge facing the service is issues of customer care. And today was even highlighted during the preliminary section. Now, the Volta Regional Hospital has come under scrutiny for various reasons because of poor customer care services. And this has directly led to reduced service utilization. People don't go to the hospital again. It has also affected their client attendance rate. And you see that as the population increases, people attending the services are rather decreasing, which doesn't really make sense. So there have also been implementation gaps. And the implementation gaps because the Ghana Health Service in their 2007 Quality Strategic Plan brought out certain strategies to ensure that quality care is being given at the facility. But because of these implementation gaps, the problems still persist. So the aim of the research was to look at the customer care practices at the Volta Regional Hospital. We also look at the structures. The practices are by the healthcare professionals. But what are the structures that Ghana Health Service and also the hospital has put in place? Then finally, to explore the challenges that they are being faced. And that influenced the overall study objective. There was a focus group exploratory study using focus groups. That means that the healthcare workers were brought out into groups and we gave them themes and topics to discuss. And we looked at the nurses because they form the largest cadre of healthcare professionals in the facility. The participants were 21 and we recorded and after that transcribed and analyzed using a thematic. analysis. So these were the main themes. We looked at the respondent's perspective of what they think customer care is. We also looked at the customer care structures, just like the objectives and the factors influencing customer care. On the practices, there was a common agreement on the practices by the nurses, and they agreed that some of the customer care practices that they often engage in are client feedback. So during the section, they ask you, do you understand? Do you have any problem? What is going on? They also showed kindness, and they highlighted that empathy and kindness. They talked about in-service training. They also talked about patient-centered care, where they make the patient the center of the care. And the staff nurse highlighted that after explaining the procedures to them, they encouraged them to ask questions and also ask them which of the explanations they didn't get. Now, the structures in the facility, they have a preceptor system. So if you're a new nurse and you come in, they give you a nurse who is older, who understands the system, who would mentor you. And I think such system is very important. They also have a vision and mission statement that is tailored around customer care, and it's all around the facility. So when you come, the patient charter, when you come, it's pasted on the wall, and all the patients are aware of their rights and responsibilities, so are the nurses. And they have incidents and logbooks to record all those information, should in case there are problems of customer care or a client is not satisfied with the service given. They are, of course, educational programs, but they were very limited. So, a rotation nurse at the chest clinic highlighted that when she came there, the preceptor trained her and everything. And sometimes they even ran shifts with them. So, what are the customer care challenges? So, the first challenge that the nurses highlighted was that, okay, we agree that there are a lot of problems when it comes to customer care. But the main issue that brings about this problem is that, one, we lack resources. And these resources lead to long waiting time. So an illustration was given that there's only one laptop, there's only one desktop at the OPD. So when you come there, obviously there's going to be a long waiting time because just one person servicing you. They also talked about low motivation, that sometimes they will work for a long time and there's no money. So by the time they come to work, they're even angry that what are they going to eat, and all those things affect their mood. And they also talked about understaffing, that there are a lot of, they need a lot of workers, and that understaffing also affects their work. And this clear statement also attributes to that. Now, in summary, at the Volta Regional Hospital, there are customer care structures, there are customer care practices, there are customer care perspectives. Now, on the factors that influence the customer care, we have staff-related factors. We also have communication barrier. We also have the OPD environment. All these are necessarily factors that impact customer care instead of just the attitude of the workers. And the findings is telling us that, one, absence of equipment leads to long waiting time. And it's not only at the Volta Regional Hospitals. A lot of studies have been done to attest to that. The administration also doesn't listen to the nurses, and that was one thing that they highlighted, that they always say customer is right. So even if the nurse has a perspective to say, as soon as the client goes to the administration and go and lodge a complaint, they blast the nurse in front of the customer, and because of that, they lose respect when the clients come. So when they also have to defend themselves in front of that, so all those things bring about a poor attitude towards work. Now, one interesting thing is that the nurses laid little emphasis on their behavior. They attributed most of the problems with customer care to the resources that they lack and also to the low staffing. So I think if these issues are looked at, we can have a balanced way of solving the problem. Now, the way forward is to, the study was primarily done among nurses, but we have other cadres of health workers. We have the lab technicians, we have all those people. So if we can also assess them and ask them what are some of the challenges with customer care. We would have a comprehensive and a holistic view of customer care in a secondary facility. Timely allocation of needed tools and resources. It's also very important. If you don't have what to work with, you can't actually do the work to their satisfaction. Now, an establishment of education programs on mostly emotional intelligence among the nurses, so that they teach them. They have already been taught, but if there is going to be a continuous education program to remind them of the customer care and everything, it would also move well. Then the development of a policy brief. So I think every facility should have a peculiar, because of demographic characteristics, they should have a peculiar customer care policy in place so that it also improves their services. And this is what we've been able to do so far from the study. We've written a report to the Volta Regional Hospital based on the study, and we are continuing the study among the other cadres. We've also developed a policy brief with my supervisor, and these are the 3 policy briefs that we've developed, and we've presented the findings in other conferences as well.